This meeting is being recorded.
Hello, everyone. I'm Ron Rolfing, your host of the ACAP Preferred Vendor Education Series. I'd like to welcome you to our latest session presented by HealthEdge, parent company of ACAP Strategic Allies Ultras to Health. Our presenters today are Jenny Giuliani, lead clinician and client management with HealthPledge, and Christine Messersmith, CMO of Denver Health Medical Plan. And they will be presenting the session. It's about the digital journey, not the destination. But before I turn it over, I do have a few housekeeping items I need to take care of. This call, along with all ACAP calls and webinars, will be held in accordance with the ACAP antitrust guidelines. And these guidelines can be viewed on our website. We will be recording today's call, and we will post the slide deck and recording on our website by tomorrow morning. And the link to these items can be found in the invitation sent to you for this webinar. And please remember, if your plan is looking for a vendor, be sure to check out our list of preferred vendors on our website. Just look to the top of our homepage and click on the preferred vendors link. And if you're inclined, you can also post a note or even an RFP on the preferred vendor connection portal. And of course, during today's session, you can ask a question at any time by clicking the Q&A icon on your Zoom window and typing in your question. And all questions will be answered at the end of the presentation. Now I'll pass it over to Jenny and Christine.
Thank you. So we're going to go ahead and get started and start talking about the digital journey. So as we get situated here, I'm going to go ahead and ask Dr. Messersmith to go ahead and introduce herself.
Sure. Thank you, Jenny. So I'm a family medicine physician, and I've been so for the last 22 years. I've had a practice in Roseburg, Oregon. The journey to administrative medicine has been a little bit circuitous. I started out by just being the physician standing in the room when everybody else stood back and saying, yeah, I'll lead that QI committee or credential committee or whatever it is that you pain management committee, and slowly worked my way through the journey to a CCO medical director. I don't know if you know, but in Oregon, the ACO or Medicaid expansion called the ACOs actually was called a CCO in Oregon. And we had a huge innovative transition to managing behavioral health and transportation and any of the services required. I also did my background education at Loma Linda University, which means I'm a heavy believer in whole person care and integrated care, which led me to become a part of Greater Oregon Behavioral Health as the medical director there as well. So I'm a firm believer in the quadruple aim. Guiding care came into that picture at Umpqua Health Alliance, where I was the medical director, because guiding care was actually started by a physician and healthcare leader there in Roseburg. And at the time, Jenny was actually utilizing their services and was a vocal critic of what she thought they could do better. So they decided to just bring her on and get her input and see if they could transform the product, which they did. So just full disclosure here, Jenny and I worked together back at Umpqua Health Alliance. And Jenny was that first nurse who taught me all about QI, slapped my hand when I got it wrong, told me what I couldn't do and what I could do. But I learned a lot from her along the way and learned how to actually manage and implement and utilize software and in this case, guiding care. Jenny?
Sure. So let me go ahead and introduce myself. So I am a nurse, and as Christine said, I did work with her at Umpqua Health Alliance. So we've known each other for a little while. And prior to going to Oregon, I did start in a large health system, doing a little bit of everything prior to even going into nursing school in managed care. So that background within managed care really started in Southern California at a very large health system. And then from there, decided, wow, there's so much you can do with nursing. And so went to nursing school and ended up doing some pediatrics, oncology, which was just amazing. But we moved to a small town in Oregon and we don't have large children's hospitals. And somehow I ended up back in managed care, but this time on the clinical end of it. And so had worked with Dr. Messersmith, as she said, with doing utilization management, care management, appeals and grievances, and quality improvement. So we've had quite the journey. And from there, as she said, I started working with guiding care almost 12 years ago now it's been. Okay. So can you tell me a little bit more about Denver Health and what you guys do and what your services are?
Sure. So transitioning from private practice into administrative medicine meant that I was dealing with Medicaid, Medicare, and all different lines of service and the expansion of Medicaid. Well, over the years, I actually reconnected with my high school sweetheart, who, and I tell this story because it's much fun, who happens to live in Colorado. I'm breaking up. Jenny, do you want to give a little bit of history here? I'll see if I can join through.
Sure. Sure. So while Dr. Messersmith gets joined back in, she was having a little bit of trouble there. We will tell you a little bit about Denver Health. So they are a local non-for-profit organization, and they are part of a larger health group. So within the Denver area, they do have 120,000 members, and they have over 20 plus years of serving these complex members. So the majority are, as you can see, Medicaid population, but they do have some commercial and exchange products. And as being part of that Denver Health Hospital Authority, they do have an integrated network with their hospital and provider network, including their primary cares and FQHCs, which puts them in a unique position where they can really coordinate a little bit better with those health groups. So it looks like, Dr. M, you're back.
Yeah, you did a nice job explaining, Jenny. So I reconnected with my high school sweetheart who happened to live in Colorado and decided that I would try to find some opportunities here. And that led me into Denver Health Medical Plan, did some consulting for them and just loved the group. And as Jenny shared, they really do focus their safety net, hospital and network, but they have a medical plan which manages the Medicaid, Medicare, commercial, and their exchange lines of business. This really nicely situated us to focus on our processes. Let's go ahead and go to the next slide, Jenny, and I think we'll talk a little bit more about our history here. So I'm going to transition for a little bit to talk about EMRs and my love for EMRs and my love for the paper world. I am old enough to remember when I would sit in front of a patient and I would have this beautiful big chart opened up across my lap, you know, those cute little single chairs that slide around the room. Well, I'd have this chart that's, 2 inches tall, sitting in front of a patient, searching for that last CT scan or MRI. And I remember the day that I had a patient in front of me and I was searching and I pulled the pages up and those little metal clips just broke and pages are all across the floor. Well, that was the day I made the decision to switch to an electronic health record in my private practice. I bring it up because it's really important to remember there was a time when we were on paper and there was a time when we were reliant entirely on paper workflows. And I'm grateful, despite any challenges that I might express at any given time, I'm really grateful for the new world that electronic records bring to us. At Denver Health Medical Plan, we've used Guiding Care or Altrista for utilization management and care management, as well as for G&A and a couple other sources. So I had experience in using Guiding Care at Umpqua Health Alliance. And when I came to Denver Health, I put that experience to good use. Go ahead to the next slide, Jenny.
Sure.
We'll talk a little bit about how that experience played a role, how our relationships and our prior histories played a role, and what we did to actually optimize the tools that we had in place, implementations, upgrades, and tune-ups, and how we use that in our partnership to improve our outcomes. So let me back up a little bit. Denver Health Medical Plan's transition. Prior to my coming on to the team 3 years ago, Denver Health Medical Plan made a decision to outsource care management in UM, and they had to reverse that decision. It's kind of funny. It turns out last night I'm sitting across from an individual that worked for the company that decided to shut down the wing that was performing this service. But when they decided to re-insource care management in UM, That meant we had to reevaluate the UM and CM teams. That's right when I was brought in, and we're rebuilding care management in UM. We had to look at the tools, what we had, what we didn't have, and what had been going on with them. We'd put all guiding care upgrades on hold when they were outsourcing. So this meant we needed to evaluate our current software, having the guiding care, and decide whether or not we're going to upgrade, how we're going to upgrade, when we're going to upgrade, and how we're going to optimize. We decided, of course, that we were going to upgrade that service. And I say, of course, because that's part of this talk. When do you decide you're going to go ahead and upgrade to the latest version? How do you optimize those opportunities? Go ahead, next slide, Jenny. So how did we make that decision? Upgrading can be resource heavy. That's really important to stop and take a deep breath at that one. If you don't resource it properly, you don't get what you need out of the product. But we couldn't take advantage of newer features, and it was really important to us that our operational processes were streamlined, and we'd like to prep ourselves for growth. So we had to be very thoughtful and planful about those upgrades and when we plan to implement them, as well as you're all aware, meeting regulatory requirements can be challenging. And when you upgrade, you have to reevaluate and ensure that those regulatory requirements are embedded. We also had to be clear that anything we're not doing well now, in whatever process we're using, could move forward in a new upgrade. And we wanted to ensure that our workflows complement the software and that we're not embedding any of our erroneous workflows into that new product. So we took the opportunity to upgrade. We took the upgrade as an opportunity, I should say, to uncover any challenges that we might have and to actually solve for them. We use this as a foundation for growth and efficiencies. And what we're going to talk about next is how did we do that? How do we go about that process? Okay. Next slide, Jenny. Perfect. So I'm going to turn this over to Jenny for just a second. I want you to tell us a little bit about what a tune-up is, Jenny, because I might have called it something different. What happened at this point is that we said, hey, can you help us figure out how to optimize your product? What does it do? Help us learn a little bit more about it. Jenny, what's a tune-up?
Sure. So when we started looking at this with Denver Health, and we heard from Dr. Messersmith to say, you know, there are certain pieces that we haven't upgraded. We don't know what we don't know. And so trying to look at what the practices are, sitting down with the team at Denver Health, looking at what is the goal, what are they trying to accomplish? Are there things that they just didn't realize that the system did because of the changeover with how the processes were working? So with a tune-up, what we are doing, or what we also call ride-alongs, we come into the client site, our partner site, and we sit with the end users and go through the system, see how they're using the system, or in this case, find out where there are pieces that just need some additional training, or maybe it had to do with different configurations, but walking through that and really looking at it at a lens of what is the end result you're looking for, what is the regulatory requirements, and helping with best practice. What have we seen with best practice for those lines of business that our clients are supporting?
Yeah, I find this one is a bit of a, well, duh, of course you would do that. But in my experience at Umpqua Health Alliance, at Gobi, at Denver Health Medical Plan, at Rocky Mountain, each of these entities, it is often something we just forget. We believe somehow we already know this stuff. So first and foremost, taking advantage of the team that knows the software best, right? Who is that? That's your vendor. They know this software. Acknowledging that we often need to relearn a product to optimize it. Now, one of the nice things about bringing UM and CM back into place is that we didn't believe we knew it. We knew we didn't know. So it put us in a nice position to say, we don't understand this product. We do need your help. The part I really want to hone in on here is not just the tune-up and the side-by-side relationship and that knowledge and expertise. First of all, we had to be humble enough to know we didn't know the product. Secondly, we had to ask for someone to come and help. But most important was developing that partnership. Partnerships require effort, energy, and superior collaboration skills. They require persistence and patience. If you don't have that persistence and patience, those teams don't figure out how to communicate, and it's a wash. And just to be clear, we've all had those moments, and we've all had to get through them. And Jenny is an expert at helping teams actually move through the process. So I'm very grateful and gracious and that we have her to assist us in that part. But I do want to say that's extremely important. We learned some very specific things, like we had to learn how to ask for what we really need. We had to learn how to collaborate. We identified opportunities that we didn't know existed, things that were in our contract that exist there that we weren't really using. We figured out how to take ownership of the product. And again, I'm going to say these seem like duh moments to me. Of course, this is what we needed to do, but they weren't already there. And it doesn't surprise me in my experience, at least in the companies I've worked with, that they frequently aren't there. We often don't know how to ask for what we need. We often don't know quite what the collaboration should look like, how we can actually take ownership. We learned how to use more self-serving, create more self-serving reports so that we could actually access what we needed when we needed them. These are just examples of things that we were able to do. But I think the bottom line is the collaboration was important. We had to figure out how to understand the product and what it can do in order to tweak our workflows to meet it and do what I call optimize it.
And I do want to say that really, as a vendor, we are your partners and we want to make sure that you succeed. We want to be a partner of yours. And that ultimate goal is to make sure that your members are taken care of. What's good for you is good for us. We want you to be successful. Ultimately, that's what we want to do. And we want to build those strong partnerships. So being able to come in and help, absolutely, that's what we want to do.
Yeah, I think remembering that for every vendor, that doesn't always look that way. When I get down into my feet on the ground teams, at times they're defending or thinking about the work they have to do or worried that they haven't done it well. So there can be a little finger pointing on occasion when it comes to any vendor, any implementation upgrade, anything that you're dealing with. So I think it's really important to take a step back and acknowledge that and develop that culture of collaboration, because really in the end, we all win when this goes well.
So were there any hurdles that you had to overcome as we were talking about this with your teams, or getting your teams excited about having somebody come in? I know it's a little bit, as you said, it can be defensive when people are coming in to sit with them and see how are you doing those things. So what kind of challenges did you guys have to overcome with having us on site?
I think you actually said it best, Jenny. There's a defensiveness to it. And the two things I think that people tend to be defensive about is that lack of knowledge and understanding about what a product does. That would be one, right? You feel like you're in this realm where you don't really understand it. You think you know, maybe. And the other is not just a defensiveness, but understanding how to ask for what you want. So not knowing what a product does and then trying to figure out how do you actually get what you really want. And we had very specific challenges, actually. Certain individuals had a particular perspective or held on to the past. They were digging in on the processes we had in the past. Getting people past that, there's no magic dust. There's nothing we sprinkle. It really takes persistence and ongoing communication. But that idea that we're on the same team, we're trying to get to the same place. And then again, and by the way, again and again, what worked the most was having you and your team on site, talking directly with our team, working through the challenges that they had experienced and trying to envision where it is we wanted to go. That one-on-one collaboration was magical.
Yeah. So I'm going to go ahead and move to our next slide and talk a little bit more about complementary workflows.
You want me to take that one on, Jenny?
I absolutely do, because this is a great one that you have talked to us about, and I think you put this really well.
Yeah, fixing complementary workflows. If you have a bad workflow and you add technology, it's going to implement that bad workflow and just exponentiate it. An error when you add technology can be exponentiated. Yet, technology really can help support. And I apologize there. Transition to my phone. Technology can actually really improve your workflow. So we're trying to balance between this idea that the technology is going to solve the world for me, or it may cause more problems. So let me balance that for just a second and talk about what I would envision. when a new software comes into play, if we expect that that software is going to use our current and same workflow, then we're not optimizing the software. My expectation is that my team understands the software first and utilizes the way it works to accomplish what we want to accomplish. That is much harder than what we were pitched 20 years ago in the EMR world. Dr. M, you don't need to change anything you do. You can do things the same way. Well, that was the pitch to get us to buy EMRs, but it doesn't work. Imagine trying to use your phone, your cell phone, in the same way that you pick up a phone that had a dial, right? We have learned to use this technology to accomplish much different things. And again, I think everybody understands this, but I think we often forget it when we are implementing new software, upgrading new software. Mm-hmm. We actually have to tweak our workflows to match the software and to optimize it. And the key to that is understanding how it functions and how it works. If we come to the table with a very rigid mindset, don't think outside the box, we don't allow ourselves to be influenced by the way this technology is working, we miss out on the opportunity to, click on a WebEx, for example, or manage workflows in a different way. A couple of the examples we're trying to share is our transitioning our referral workflows from email to guiding care. That seems like an easy one. I mean, really, this seems like low-hanging fruit. And yet for those, for my team that were feet on the ground, they couldn't envision how that would work. They had to come to the table with an open mind and understand how the product works. Optimizing business rules is a good example. Again, this is really low-hanging fruit, and it may seem obvious, but in this safety net healthcare world, in this Medicaid world, we're often behind the times. We're not markedly digitally mature. And we do have to own that our workflows may not function in this new world, and take a deep breath and move forward. What did you see, Jenny?
I think absolutely that's part of it. And we see this a lot. And it doesn't matter how many times you come into a different client space. It is a lot where we don't like to change. We're clinicians. We don't like to change. We have a way that works. And it's really hard to use a new solution, a new way of doing things. And so as we work with teams to be able to do that and really getting people excited about some of those things where it's not going to be double documentation in order to get through your workflows. I think those are big things. And once we can get that excitement, which is absolutely, change isn't as big of a deal, but those are usually the challenges that we see. And I think once we sat down with your team at Denver Health, the excitement came in, and we could see that excitement and the light bulbs going, oh, that's awesome. And so I think that makes a huge difference when you can sit down and look at that.
Yeah, if I could choose a vendor, the biggest thing I would say is a vendor that is willing to sit down with me and collaborate, but also can ask me the right questions. What are you trying to accomplish here? Not what exact button do you want to push when you do this, but tell me more about who your end user is in this situation. Tell me what your goal is. Tell me, I love this little picture start to goal, right? Where are you trying to go with this? What is it you're trying to accomplish? Those are great questions that get us out of how we get there and more about what is it you're trying to do. And by the way, there's a really cool way you can do this in, for example, guiding care or whatever tool you're using. Those conversations are hard to get to. Continue to be challenged by them, even in requests for analytics and reports. This is a hard space to transform the way we ask the question and what we expect. Mm-hmm. Thanks, Jenny.
You are welcome. I'm going to go ahead and move to the next slide and talk a little bit more about uncovering opportunities. So what are some things that you found as we went through this process?
Well, first and foremost, we're going to backtrack a little bit here. We made a decision to optimize our current technology. We could have chosen to implement another technology. That would have been an option. We had to do so, right? We had this on the table. We decided that the current tool we're using is working well, but we need to optimize it. Then we actually had to do some planful implementation and upgrades. So planful is really the important part. We're still not upgraded to the point that we need to be. You're aware of that, Jenny. We had one upgrade, and we've scheduled and planned and resourced our next upgrade. And we're very happy with that process. Others might have chose to do it a little quicker. Others might have chosen to do it a little bit more slowly. We're happy with it because we did what I believe is the right thing to do. And that is evaluate our current workflows, match those to the regulatory requirements, and take full advantage of that relationship. And then as we do that implementation, it's on point. It accomplishes what we want it to. So that would be number one. That part about fixing our complementary workflows. I think we've talked about this several times now, right? We must understand it to optimize it. The biggest mistake I think we make is suggesting that our vendor is the only one who should understand it and that we don't have to. In order, every vendor, regardless of what situation you're in, they are experts and they need to come to the table, but we understand our own business. And since we understand our own business, we need to understand that technology and how to collaborate. Otherwise, you can't collaborate. You can't use and configure a system. So you have to resource it appropriately, and you really have to understand it. You can't just ask that the vendor understand you. It is a dual relationship, which is number three, right? It is a partnership. And there are relationships and vendors that I've worked with that we are not partners in. It is not successful if we're not partners and we don't have an aligned incentive. I love the bottom line, right? Technology should manage the mundane so teams can focus on things that require their subject matter expertise. It's supposed to support me in what I'm doing, right? It's not supposed to make my life harder. And this is just my formula for how we get there. Thoughts, Jenny?
No, I again, coming back to those partnerships, we have found that those clients of ours that do want to partner with us and collaborate with us, again, they have these great success stories. We know that upgrading is not always easy. We have had, like Denver Health, some clients that have been very far behind on upgrades. And at that point, it is really, it's imperative to work with your teams to find out what's new, what are we doing, what is that regulatory requirement. And so I do want to say that everything that Dr. M, you've pointed out here, again, I know you keep saying that it seems like it's obvious, but so many times we get in these traps. And so I think that this process was a great process, and we're going to continue to work on it as we look at doing your next upgrade and looking at some different workflows. We've seen in the past certain places, even before we've worked together in our own individual experiences, where upgrades have failed, where implementations have failed. And there's been some reasons for those failures. Just again, looking at how do we work together? How do we look at those workflows? And again, complement the workflows with the software, take advantage of what those are, but don't try to recreate, because you can create yourself into a mess or make it to the point where it's not usable.
Yeah, I was going to add one thing. I was listening to a podcast by Malcolm Gladwell. He's a fun one to listen to, talking about complex versus complicated problems. Human beings are complex. Software tends to be complicated, meaning that there is a solution, there is a path forward, but it requires multiple different departments or input. Complex things often have never been solved before, just so you know. So software implementation, software upgrades, I think they are a mix of complex and complicated. We have complex human beings trying to solve complicated problems using complicated software. It's a maze. So when something is complex or complicated, the only way you get there is working together. And it is simple, but it's hard to work together with someone else when you are dealing with something you've never seen before, complex in that setting, or something you just don't have the bandwidth to understand. That's why it requires that I would call it cross-departmental or interdisciplinary teams, right? These are these medical terms. It requires interdisciplinary teams to accomplish the task.
Okay, I'm going to go ahead and take us to our next slide. Questions and answers.
Okay, our first question today. As far as time is concerned, how long did this process take you? And this is for Dr. Messersmith.
Sure, and I guess it depends on which part of the process. The tune along or tune-up ride along, that was really, I think, about 72 hours worth of the team's commitment and time. So, we set aside time where they're sitting together and working through the group process. From the time they came for the tune-up to the time we implemented, I would say was about 6 months for our upgrade. Jenny, you might correct me if I'm off base on that one.
I want to say it was about 6 months because it was implementing different workflows as well as upgrading and changing some configurations.
As the medical director, the amount of time it took was those 3 days, making some decisions and choosing to support my team in understanding the work. Feet on the ground, each of those teams had varying degrees or hours that they would put into the work and the collaboration. But the upfront time, really, 72 hours of dedicated time in a tune-up.
Okay, our next question. What improvements have you seen in your reporting capabilities?
Oh, that one is huge. I think the easiest thing to point to is our turnaround time. So I think I described we were outsourcing our UM and CM functions. We re-insourced our UM and CM functions. And at first, we're having a lot of challenges with turnaround time. So utilizing the collaborative approach and optimizing our reporting structure, we were able to, within about 90 days, turn our turnaround time to about 99 percentile, which is fully attributable to the ability to report accurately and real time. You can't make changes and adjustments to your process if you don't know where you really are.
Okay, our next question. Many health plans are just starting out on their digital transformation journey. Given your experience, what advice would you provide to them?
Partnership, and partnership, and then a little bit of humility in coming to the table. We don't know what we don't know, and our partners don't know what we don't know. So that persistence and humility is probably the biggest piece.
Okay, well, that looks like it takes care of our questions for today. With that, I'd like to thank Jenny and Christine for a very informative webinar today. I'd also like to thank all the attendees for taking time out of their day to join us. Just a reminder that the slide deck and recording will be posted to the ACAP website by tomorrow morning. So keep an eye out for that. So thanks again and stay safe.
Thank you.
Well,